Treatment options that are geared towards diabetes type 1 and type 2, they can differ a little bit, but in general, they're mainly the same. So the first treatment option is the use of exogenous insulin, and this is type 1 diabetics are dependent on exogenous insulin as their bodies cannot make sufficient amounts of it. And patients on the later stages of type 2 will also be on exogenous insulin. And this can be a combination or single use, it could be single insulin or a combination of different insulins. And these combinations would be rapid acting, like your Lispros and your Asparts. Um, uh, Short acting would be your regular insulin. Um, Your intermediate acting would be NPH, and then long acting would be the Lantus and the Levemir. So combinations of these are basically geared towards keeping a optimal blood sugar level, and so the providers will determine what is appropriate in order to achieve this goal. Another treatment option, and this is geared towards type 2 diabetics, is to use oral anti-hyperglycemics. And these medications are geared towards correcting deficiencies that the type 2 diabetics have. One of these would be to increase sensitivity to insulin, or to increase the insulin production of the pancreas, or to decrease the hepatic synthesis of glucose. Um, and these oral anti-hyperglycemics, these are your metformins, these are your sulfonylureas, these are the glipizides, the Starlixes. And again, the provider is the one who determines what is appropriate for the patient to be on. Another treatment option is one of the more important ones, and this is meal planning, as diabetes is nutritional in nature. In regards to blood sugar, patients should be eating more complex sugars. They should also be getting adequate proteins, low fats, and also adequate fiber. Um, Patients would typically want to avoid simple sugars like junk food, donuts, chips, sodas, as the sugar that puts them more at risk to become hypoglycemic. Uh, Another treatment option is to simply lose weight, exercising. Increase weight loss improves the glucose tolerance of the body, so the more weight loss for especially obese patients, the better. Um, but also to a degree, if the patients are unable, especially large patients, are unable to lose some weight, bariatric surgery may be indicated to help the patient move along in this regards. And lastly, the other treatment options are simple transplantations. This can be of either stem cells, islet cells, or even a whole pancreas.